Hello, everybody. This is Dr. Gita Mathai, and this is my Health Vibes channel. Today, we are going to talk about diabetes. Diabetes is so common in India. More than 100 million people have diabetes in a population of 1.2 billion. This means that out of every 100 people, 11 people have diabetes. But a lot of people don't realize they have it because symptoms of diabetes appear very late. They may be feeling fine and carry on, and then during a master health checkup or a checkup for something else, suddenly the blood sugars come back in 300s and 400s. People are disbelieving. How can I possibly have diabetes? I'm only 20 years old. Nobody in my family has diabetes. That may be because your grandfather's time and your great grandfather's time, nobody actually checked for diabetes unless patients were really symptomatic and had boils which didn't heal or got some other infection. People were not routinely and regularly checked as they are today. And what happens in this diabetes actually is that there is an organ in the body called the pancreas. The pancreas secretes insulin and it also secretes another hormone called glucagon. Insulin is the pancreas is very sensitive. So when the blood sugar level rises, the insulin is in secretion is increased. And when the blood sugar level falls, the insulin secretion decreases and glucagon secretion increases so that the blood sugar remains constant whether you eat 1 kilo of laddus or you starve the whole day. Now, in a person with diabetes, this sensitivity is lost. There are two types of diabetes. There are people whose pancreas suddenly stop producing insulin or never produced any insulin at all. This can happen in families because the pancreas is genetically prone to damage, and the damage can occur because of a virus infection or it can occur because the body does not recognize the cells in the pancreas as its own body and attacks and destroys them. So suddenly the person's blood sugar goes up very high, and since there is no insulin, they have to have injections to lower the blood sugar. People who get diabetes because they produce less insulin that is required for the amount that they eat, those people do well with tablets because tablets increase the insulin production of the pancreas. Some people require a combination of injections and tablets. Diabetes tends to run in families, and this may be partly genetic and partly because of the environment. Nowadays, more and more younger people are developing diabetes. That is because our lifestyle is not as active as it used to be. We hardly walk anywhere. For everywhere to go, there is a auto, there is a car, or there is a two wheeler or a bus. And children, once they come back from school, they sit and they watch TV or they play on the cell phone. They don't actively take part in sports or games. How do you know that a child is going to develop diabetes? One of the first signs is a blackish discoloration in the neck and the axilla. This is called acanthosis nigricans, and it is not dirt. Parents try to scrub this off, but it is under the skin and it won't come off. If you see that, it means the child's physical activity is not enough and also is prone to diabetes. People get very upset when they develop diabetes. They say, when am I going to get cured? Well, unfortunately, this is not a disease that can be cured like a fracture or a fever. Diabetes means a change in your lifestyle and medication probably for the rest of your life. But is all diabetes like this? No. Some people develop diabetes only when they're pregnant, and this gestational diabetes recovers once the pregnancy is over and the child is born. But remember, you are prone to develop diabetes and maintain a healthy diet and lifestyle for the rest of your life. People who have polycystic ovarian disease or metabolic syndrome X are also prone to develop diabetes, and they should take it as a warning sign and correct any correctable factors. These are the only three types of diabetes which are reversible. What is the treatment of diabetes, whether you're on insulin or on tablets? The physician calculates the medication dose based on the amount of calories or the amount of food he has asked you to eat. So, if you suddenly starve one day, your sugar will go down. And if you suddenly eat a lot, the sugar will go up. So, you have to maintain a constant diet. And in order for the tablets and the insulin to work efficiently, you have to walk. for 40 minutes a day. 40 minutes of exercise is the minimum requirement to keep the sugars under control. This is Dr. Gita Mathai signing off. This is my Health Vibes channel. If you liked what you heard, please subscribe and press the bell button. The same content is available in Tamil. Thank you.